One of the great things about this new space is that everything was designed with kids in mind. So from our artwork to the common areas that are kid-friendly to our outdoor patio space that will enable kids to be able to have some recreation time each day outside. All of those have been designed with kids in mind. My name is Amy Meadows. I am the Division Director for Child and Adolescent Psychiatry. We have known for a long time that we need behavioral health spaces specifically for children and adolescents. So we've had for a long time an adolescent unit, which is kids 12 to 17, but our new unit will actually expand our age range so that we'll be able to care for the behavioral health needs of kids down to age 5 all the way through 17. So I think what across the country we have seen has been an increase in the amount of serious mental health needs in kids and adolescents. So there have been increases in the amount of emergency room visits for certain indications like suicidality or eating disorders, and Kentucky kids have been affected. One of the things that we have seen at Kentucky Children's Hospital has been an increase in the number of kids coming in through our emergency rooms, and part of our unit expansion is really to address those needs. This space is really for kids who are having behavioral health emergencies. So behavioral health emergencies can be kids who are having thoughts of hurting themselves, kids who are having thoughts of hurting someone else, or kids who are struggling to take care of themselves for any variety of reasons. Kentucky Children's Hospital does have the capacity to care for kids with eating disorders, and that will be a partnership between the pediatricians and our new unit. Our space really is designed for crisis stabilization to help get kids through very challenging behavioral health emergencies. So with that in mind, we have daily group therapies, so talk therapies of various kinds. We have daily meetings with doctors, psychiatrists to help manage medications. We have psychologists, social work, chaplaincy, art therapy, recreation therapy, all coming together to help get kids better. Kids age 5 are very different than kids who are 16 or 17. They have different ways of understanding the world, and really our unit and the programming will be designed for younger kids as well as our teens and adolescents. They will have separate tracks, so teens and adolescents will be on one side of our unit and have separate programs, including separate group therapy, and our kids will have their own group therapies, their own individual treatment, lots of play-based interventions, because that's how kids that young understand the world. If you have a child who has mental or behavioral health needs or is in crisis, the best way of getting services is to go to the McKenna David Pediatric ER at Chandler Hospital, where they can be evaluated and we can connect them with care, either inpatient or outpatient, depending on what's needed. Mental health is a part of health. You can't have health without having emotional health, and so it's an incredibly important part of the overall well-being of children and adolescents to have their emotional needs taken care of as well.